Good morning. I'm going to call the Truckee Meadows Fire Protection District Board of Directors meeting to order. We will start with a salute to flag. Captain Layton, would you lead us this morning, sir? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, sir. Madam Clerk, would you call roll, please?
Good morning, Mr. Chair. Von Hartung, Chair.
Here.
Bob Lucy, Vice Chair.
Here.
Marcia Burkbigler.
Here.
Kitty Jung.
Present.
Jeannie Herman.
Here.
Deputy Chief Alex Kukulis.
Here.
Deputy District Attorney Nathan Edwards.
Here.
I'm Nancy Parent, County Clerk. You have a quorum, Mr. Chair.
Thank you. Chief, welcome. Item number 3, public comment.
Thank you. Good morning. Item number 3 is public comment. Comment heard under this item will be limited to 3 minutes per person and may pertain to matters both on and off the Board of Fire Commissioners' agenda. The district will also hear public comment during individual action items, with comment limited to 3 minutes per person. Comments are to be made to the Board of Fire Commissioners as a whole.
Thank you, Chief. Madam Clerk, do we have any public comment?
There is no one signed in, sir.
Okay. Is there anyone wishing to speak before I close this? Seeing none, we will close public comment. Chief, item number 4.
Item number 4 is Commissioners' Fire Chief's announcements, requests for information, topics for future agendas, and statements relating to items not on the agenda.
Okay. Commissioner Herman, I have you signed in.
That was quick. Thank you. I had some people that were curious about the number to call about the green trash days, the pickups or wherever you needed to bring it, and maybe a phone number would be good to put on the record today. And then, okay, so some of us feel like we're not on the fire list anymore because we haven't gotten any. And I had one in the last couple weeks, so call about fires. So please, could you make sure we're back on the list? I have had a mountain lion kind of scoping out my cows here lately, and I need to get my rifle sighted in. So I just was wondering how we were progressing on finding a place for shooters to go and do that. So if you could maybe give us a little report on that in the near future here. Thank you very much.
Okay, thank you. Commissioners, anyone else? Commissioner Jung.
Thank you, Mr. Chairman. Yeah, I'm also not receiving texts about alerts of fires. I'm finding out about the fires in my district and across the county that TM is fighting on the news. So I think that's what Commissioner Herman was referencing, and I'm just wondering, did we get dropped off the list? Have there not been texts going out? What is the criteria? Maybe we're not, but usually, not only usually, always, I get texts when the fire is happening, when it's over, and it is identified what district it's in, and instead we'd had several house fires that I learned about on the news. So, and that's not acceptable. Thank you.
Okay. Commissioners, anyone else? Okay. We'll close item number 4. Item number 5, consent. Chief.
On the consent items, we have 2 items. One is approval of the minutes, and second is approval to give the chief authorization with approval from the chair to pursue purchasing a ladder truck for the district in an amount not to exceed $300,000.
So moved.
Okay, well, okay. Commissioners, does anyone need any information on the consent agenda? Okay, so I have a motion by Commissioner Herman, second by Commissioner Burkbigler. Madam Clerk, is there any public comment on item number 5?
We have no one signed in.
Okay, I will close public comment. Motion by Herman, second by Burkbigler. Any discussion? Seeing none, all those in favor, please signify by saying aye.
Aye.
Any opposed? Motion carries unanimously. Chief, item number 6.
For items 6 and 7, I'm going to go ahead and move down to the podium for some employee recognitions and promotions.
Okay?
How come the thing didn't change?
Welcome, gentlemen.
So item number 6 is employee promotions. We have 2 employees here with us this morning. We've got Aaron Reynolds to my right and Ryan Scannell next to him. Both were recent hires in the last few years with us. They were hired as firefighters pending their successful completion of their paramedic certification. It's a very rigorous program. Chief Cameron puts them through in the way of training and getting them up to speed. I believe we hold one of the higher standards in the ALS certification program in the region. So it's been no easy task. One had a recent child, and still a lot of work goes into all this at the same time while trying to also work through their probationary period as firemen. So with that, I will present their new badges to them, upgraded. And is your wife here? Come on down. So for Ryan Scannell, this is his wife, Amanda, presenting him his badge. If I can get it open.
How precious.
And for Aaron Reynolds, we're still working on finding him a wife, but Chief Hicks is filling in for him this morning. I thought you'd have got this easier than she did.
Gentlemen, congratulations. Well done.
Move to item 7.
Please.
Item 7, also employee recognition. We have 2 separate groups, but wanted to go ahead and highlight them for job well done. First crew, we have Captain Shane Ackerson, Engineer Shad Vetrock, and Firefighter Paramedic Alex Dorr.
A field baby delivery.
Yes.
Was it Mr. Scannell's?
Not quite keeping it in the family that way. So yes, we've talked a lot about some of the difficult things our crews have to deal with in recent times, but it's always nice to highlight the positives. So just the brief background on this, they were in Station 46, Sun Valley at the time. I'm sorry, Spanish Springs.
Thank you.
They were dispatched to a delivery in progress, got on scene. I think the baby was born basically within seconds of them walking in the door. So it sounds like it was pretty routine, and baby's healthy, well, but we just wanted to present them with their stork pins for a field delivery.
I'm not convinced that childbirth is routine in any way, shape, or form. Congratulations, gentlemen. Well done.
Thank you. And our second crew we're bringing up today is Captain Scott Layton, Engineer Chris McNaught, and Firefighter Paramedic Kim Jarding.
The family's here.
The family with the baby?
Yeah.
Okay, so let's hold on just a second.
was just told.
No. Complete this, chief. And then what I'd like to do is we'll go back and yeah.
Yeah, we'll bring them back
this
up.
baby up,
I'd
yes.
like to. Well, real quickly, so this was a more difficult call, but ended well. So they were working in Sun Valley, District 45. Happened to be in district at the time of the call, returning from another incident, so they were close by and dispatched to a cardiac arrest. They were able to get there very quickly. The crew worked very well together in coordination with REMSA. They deployed all of the bells and whistles, the Lucas devices, our new defibrillators, went through all that and ended up transporting the patient with pulses, and as we know it, he's surviving and doing well now. So we've also got pins for them, Lifesaver Awards. Go ahead and present those to them.
Congratulations. Thank you so much.
You want to do a photo op with the?
Yes, yeah, absolutely.
Sorry, yeah, I was just told they were here after the fact. Is this our new baby? She's hiding still. I don't know if we're going to get the photo op. What's her name? Jasmine. What's the last name? Jasmine Castillon is our new baby here. Why don't you guys get together in the middle? Yeah, there she is.
Congratulations. Can we, Chief, can we do a picture with them also?
Yeah.
So that it can be posted? Yes.
Yeah.
Yeah.
And then with the other groups too. We'll just bring them in and do that now.
So it just came with like nothing, huh? Just come right simple. Being a mother, it's just so easy.
We need to sit down more.
Just get real tight.
And are you the big brothers? Yeah. And twins? No, they're 2 years apart. Well, and you're the oldest? You're the boss. I'm the youngest, not the boss. I'm Jasmine, I'm not the boss. I know. He's the big brother, they're always.
Yeah, and they didn't jump to complaints or deaths. Just wanted you to be honored. Yeah. Yeah, I fully expected it. Yeah.
Congratulations.
Thanks, Nate.
So our daughter was nearly born on the Pyramid Highway some 30 years ago. We lived in Spanish Springs that long. And she was breech and.
Did they really?
And I was
I
flying.
bet. We
We didn't have the same level of care.
Beautiful kids.
Station.
What's your name?
That's your story.
What's your name?
That's what we get.
Yeah.
Dreas? Drea?
Yeah.
Julius? I don't speak to you. Who does your hair? Who did your hair? Mom and dad? Oh, you are? Are you kidding? Are you a full-time carrier? My dad's retired after he retired from the Air Force. That's what I want to do in my retirement. I want to carry it, not drive. I want to carry it and not drive.
Carry it and not try to wash.
Yes.
Yeah.
Year round.
All new.
Well, not as far as I live in Reno, and I don't know Reno. I have a walk, yeah, and I want to miss out. That's a good job. I mean, when you're in full-time, it's good. Did you start out as the coming up? No, right? Glad that voice was there for you. Oh, yes. Where are you from? What?
Babies, we never took care of babies. Get all the germs on them. Should we do the next picture? Yeah. Nice to meet you. Thank you, guys. Take care. Bye-bye. In the middle, guys.
Lifesavers.
You go over here. You're a lady. Are you the baby of the family? Are you the youngest?
No, I would promote it. Thank you.
But you're the baby. Thank you so much. I know your mom's
Who's 19 minutes here? Who is it?
Let's do this again. One more. Yeah.
Is he really? You tease him? No.
You guys pay attention to the card.
Okay, there we go. Perfect, thank you.
But your tip is, how many kids are there?
4?
Tell your mom I said hi.
There's,
I
yeah.
love your mom.
There's an
She's
entire
amazing.
thing of parts.
She knows me. Just say, Katie says hi.
Oh, I'm sure, yeah.
You have one more? You're doing good too.
Did you want with the promotions?
Promotions, Bob.
Do we want to,
Oh, we do
the two
promotions?
paramedics?
Oh, Commissioner, one more.
You try this. All fire.
Just do the chairman's office. Just do the chairman's office.
I go right. Yeah. But I like it.
My dad used to be
Congratulations.
retired.
Up in here, guys. Kidding. Come on.
Oh, you're kidding.
I was a Reno.
Really? Well, welcome aboard.
Thank you.
Thank you, guys. Congratulations. Are you going to go to Sparks and meet the chief?
No,
Isn't that the way it goes?
I've got 4 years on the parents. That's where I'm doing this job.
It's the good life. It's the good life.
There you are.
I've only been like 20 minutes.
Okay. All right. Wait for the chief to come back up. Again, congratulations. What a beautiful family you have. Okay.
Congratulations to everybody.
Item number 8.
Item 8, the Annual Emergency Medical Services Oversight Committee presentation to regional councils to include data collection and reporting and compliance versus performance, presented by Christina Conti from the Washoe County Health District.
Ms. Conti, welcome.
Thank you. Good morning. This is our annual presentation. We are a little bit delayed this year because we had some issues with receiving data from the different partners. So I'm actually going to be presenting from fiscal year 17, 18. So just a quick reminder about our program. Here's your team. I'm the program manager. We have an EMS coordinator, statistician, office support specialist that's 50% with our program, and then the advisory board support, Dawn Spinola. The interlocal agreement just celebrated its 5th birthday.
hard to believe. One of the biggest changes is that it actually changed the health district's authority from just a compliance-based system for the franchise agreement into more of a system performance viewpoint. So it also established the EMS Advisory Board and clearly defined the duties of our program as well as the signatories. So the biggest point, so here's the EMS Advisory Board. So it's the 3 managers from the political jurisdictions, the district health officer, an emergency room physician, and then a continuous quality improvement representative. And both of those are from regional hospitals. The biggest change that the interlocal agreement created was this notion and this goal of a concurrent review of programs and projects within the region so that it could kind of vet with all the partners and then push itself up. So this is the idealistic organizational chart for the interlocal agreement and the EMS oversight program. So as I mentioned, we're going to be talking about the fiscal year 17-18 annual report. Fiscal year 18-19 will actually be published in November. So we are on target with that. That's the date that it would be expected. So there's approximately 8 EMS-related calls for service every hour. In fiscal year 18, there were more than 70,000, almost 71,000 EMS calls for service with all our partners. And here's sort of the pullout data highlights. So there's only a 1% increase in calls that were matched between fire and REMSA from the previous fiscal year. So that's quite a slowdown from what we had seen before. When you look at the travel times, the en route to a first fire responder on scene regionally was 4 minutes and 19 seconds. For REMSA was 5 minutes and 52 seconds. The patient perspective is the one on the bottom that we believe is actually the more beneficial one because citizens don't care who's knocking on the door as long as help is coming, especially if you are in labor. So what you see up there is from the patient perspective of when they dialed 911 to somebody knocking on the door. So priority 1 is 5 minutes, 52 seconds, but overall it's 6 minutes and 14 seconds. And this sort of shows the pie chart of the arrival on scene. There's 6 different ways that somebody can, that a call can go down with cancellations and arrivals, and so this depicts that. So one of the biggest things with the regional report is the opportunity to highlight the accomplishments from a strictly EMS perspective. So what you have in front of you is the things that we believe were really the most critical accomplishments of the region. The implementation of appropriate protocols was something that had begun previously, but we added to it. So Omega calls, February 1st, had more calls being added to those. Card 33s are facilities that actually have some level of medical capabilities there and AED support. And so they are now receiving a different response model starting July 2nd. And then Alpha calls, which are very, very low acuity calls, are also receiving an alternate response starting October 1st. A huge accomplishment for our region was the development of pre-hospital protocols so that all regional agencies, including the volunteers, are now on the same set of protocols. An addition that happened the last iteration is Story County actually asked to sign on. And so Story County is now a part of the protocols as well. So there's 9 agencies that operate under the same protocols. We developed a training for first responders that we know is now being used based on the legislative initiative. So it's not just because it's the right thing to do, but it's now mandated, and it's on intellectual and developmental disabilities. Understanding that if there's imminent danger, getting the citizen out is absolutely what happens, period. But if there's some time to plan and take those considerations in of the citizen's needs so that we don't provide secondary harm, this is a way to provide some education. And it's not just EMS, it also is post-certified, so our law enforcement partners are also using it. And then a big thing of interest is the Alpha plan. The MCI plan was updated, and we actually added back in fiscal year 17, a alpha plan. And that looks at if there are more than 100 patients or multiple locations. And so this actually is something that was in process before 1 October. And so that's something for our region to really be aware of and be proud of, was that we were thinking about it and planning it before it then became really clear that we needed it. The establishment of CAD to CAD interface is still an in-process project between City of Reno and REMSA. We are very hopeful that they are in the live testing phase right now, hoping that it pushes itself through so that the other jurisdictions can have it soon too. And then CQI, continuous quality improvement, is something that we are still sort of striving to get to. Hopefully, everybody has seen this. It was a big campaign that we did within the region, which is looking at not letting non-emergency calls compete with emergency calls within the 911 system. There was a lot of different graphics that were used. So depending on what resonates with you, one of them would be would depict very clearly what it is we're talking about. The other thing in the annual review is the partner agencies include their own highlights. And just a reminder, we do not edit that at all. All we do is put it in the format for the report. So those are the words of those partners and what they believe their accomplishments to be. So a plug that we're needing this year's stuff now, Chief. Okay, so what we're currently working on are the updated strategic plan. So in May of 2019, I'm not going to read all of these, but I'm happy to answer questions on all of them. This is what the new strategic plan that's going to guide the next 5 years looks like for this region, and what all the partners have agreed. And the District Board of Health said, yes, this works. So looking at enhancing the utilization of EMS resources, improving pre-hospital EMS performance. And underneath there, you see the objectives. And then in the strategic plan itself, there are strategies that outline exactly how we're going to do that as a region, so that we can say, yes, we know that we clearly met this objective. We're going to be looking to improve our communications capabilities and enhance the EMS system through improved quality of care, or continuity of care, quality as well. And then the recurrent callers becomes a real challenge for our region, and so that's something that we are going to continue to try to work on. And then a continued collaborative model, which is one of the reasons that I come every year before the various signatories, is to be able to say, this is what the region is doing, this is what your EMS oversight program is doing, and have that loop closure. The final thing that I want to talk about real quick is actually not something that we did during the fiscal year, but we're taking the opportunity when I'm in front of the councils to talk about it. It's a community assessment for public health emergency response, and it's actually, so it's called CASPER, and it is a CDC model. And what they say is, if you can sample a small group of your community using their algorithms and their methodology, then you can actually apply those findings to your entire region. And so a lot of this is used after a disaster to be able to say, hey, what exactly does your community need? We did it with Heather Kerwin leading the charge for a preparedness effort, so that if we had a large-scale emergency, we could actually know what our baseline had looked like, so that then we could go out if we needed to survey and get some information. I would like to give a shout out to the entire region that we are the best in the state with 94% completion rate. So that's very exciting. So the things that are written up here that you see are the analysis that got pulled out. The things in red, I think, are really what's going to be beneficial for you guys, and I know it's something that you've talked about before. So less than half of the households were actually aware of the emergency notification system code red that we use to evacuate. The majority of the households say that they intend to evacuate in the event of a voluntary evacuation, and so we know that that is in conflict with what we see. And so that provides an opportunity to kind of troubleshoot with partners and figure out if maybe there's a messaging change that we can make. And then the biggest thing that we find value in is that 94% of households reported they could evacuate within an hour without assistance. And so that is critical for our first responders to know. So the recommendations, the only things that I'm going to say about this, because I know I'm out of time, but
You're
You're not out of time at all. You keep going.
Thank you.
This is important stuff.
We have put some FEP money, which is the Public Health Emergency Response, Preparedness and Response dollars from CDC towards the recommendations from the CASPER so that we can start getting some information out there and educating our community. So we started that with the Food Truck Friday partnership with Washoe County Emergency Management. And so we hope throughout the year to really start looking at moving the dial on some of those percentages that we saw, the biggest one being Code Red, because if that's what we're going to use to tell people that they need to leave, then we need them to be aware of it and part of the system. So the biggest recommendations also would be providing things in both English and Spanish, collaborate with neighboring counties, because Carson City, when they do any kind of messaging, that's coming into us too, so making sure that we're sending the same messages. And then the planning and redundant communications. One of the things that our community doesn't quite appreciate is that communications will be impacted in a large-scale event. And if your phone goes dead, do you still have the phone number for your mom, your dad, your brother, your sister, your family, whatever, right? We don't memorize them anymore like we used to. And so that is going to present some challenges, especially if people don't have that written down somewhere. So we're going to really start doing the push this year. We'll partner with anybody who wants to partner, but we put some money into it so that we can start making a change. And with that, I will answer any questions you might have.
Okay, I actually just have a fast question on the Code Red, and we've talked about this on a number of occasions about how do you contact households? How do you make sure that if there's someone in that household that is not ambulatory? But something occurred to me as I was reading this, and I just made a quick note. Do we partner with Amazon to work backwards so that the Amazon Echo, that Alexa will talk to people and say, hey, it's a Code Red, and you know, because I know a lot. I don't have an Amazon Echo. My sister has one. She loves it. She
They
thinks
are
it's,
always listening.
They're always listening, but
Right.
there are a lot of elderly people. In fact, we're giving great consideration to getting my parents one to remind them to do things at certain times and et cetera. And so I'm just wondering if we've thought about partnering with Amazon to work backwards,
Right,
so
and do
that
that.
it's tied into our system.
I have not been a part of any of those conversations. If they're happening, I am not aware of them, but I'll make a note. I don't know how that would work, but with technology, I mean, it's probably possible.
Okay, thanks. Commissioners, anyone else? Commissioner Jung.
Thank you, Ms. Conti. Terrific job, as always. I always tell people, the one thing that I admire so much about you is that you can learn anything, and that's a real compliment.
Thank you.
Not everybody can do that. A couple of things specific to this, and then trying to figure out in my own wayfaring where I should go. Do you do post-hospital care, or is that completely in a different area with indigent funds that the county pays for our patients here in Washoe County?
We do not do anything with post. We're working with hospitals to obtain their data for discharge data, but that's more to finish the continuum because we have 911 till hospital drop-off, and we just
Right.
need that extra piece, but it wouldn't include kind of the post-discharge piece. We wouldn't
Okay,
have that.
I'll bring that up at commissioner announcements then. I do have a question for you, and something that has been discussed up here at this board as well. Do you know to what extent first responders, as well as areas that could have multi-casualty event, about supplying those areas with tourniquets and teaching people how to use tourniquets? Because in those mass shootings, right, the biggest thing is loss of blood is what's killing people, and learning more to be battlefield ready rather than basic first aid. Where does that fit in your area, or is that someplace else that I need to?
No.
Okay.
You have the right person, wrong program.
Okay, great.
So that's the preparedness side of the house where we're
Okay.
doing that, both the CDC grant and the ASPR grant, and it's called Stop the Bleed.
Okay.
It's also written into, so back to EMS, it's written into the franchise penalty funds approval to provide Stop the Bleed trainings within
Great.
this community. So For Washoe County employees, for sure,
Yeah.
they can sign up through Bridge, and it becomes available on there a couple times a year.
Okay.
And then what we'd like to do is move it out to say, where community-based one, so that it can be community. The school district is starting to employ it, and they're doing more of a train the trainer. So every school will have somebody who's trained to teach it, and then it's going to roll out through those schools. So it's been occurring within our region slowly for maybe 3 years now.
Okay, great. I'm just glad that you are in charge of looking that over. When will we get is there any more data from the door-to-door and how that was done and who was hired and what is the survey? You don't need to do it right now, but if you could send that to us, I would like to see that and where the sample was selected from, what the addresses were, et cetera. I just want to see and listen, I know Heather Kerwin is a data machine and would never make a flawed study. I just want to look at it for my own statistics fascination.
Yeah, absolutely. We worked with GIS, and so we used the CDC methodology. I will say that nobody was paid. It was all volunteer-based, whether it was Citizen Corps or Health District volunteers, or even we put it out through the county, so other departments helped us. But GIS actually used the methodology and lifted the
Nice.
addresses using, the count. I don't know. It's like every 7th house and
Neat.
it's a whole thing.
I love it.
So we'll put together a packet for
Okay.
you and send it over.
Thank you very much. Great job.
welcome.
Commissioners, anyone else? Okay, well done.
Thank you so much.
Really, really nice presentation. Thank you. Chief, item number 9.
Item 9 is the fire chief report. A few items to go over here. Update on the Hidden Valley Fire Station development. Chief Moore's been working with staff and City of Reno. There is in your board packet an update of the proposed layout, but there is no specified timeline on when that will go before the Reno City Council. So this will be an ongoing update item for the site plan. Under ambulance billing, we are working with Chief Joe Kamen and ourselves trying to identify a vendor who will be able to establish ambulance billing system for us. We will come back to the board at a future date once we have that arranged and a proposal for any kind of possible rates if we want to adopt anything like that. That's following the ambulance that we acquired earlier this summer. And so that thing's now ready to go in service. It would be still housed in Washoe Valley, where the other one is, effectively replace that and just make a redundant backup model there. But we'll be back with that. Green waste collection days, as mentioned earlier, those are coming up. We have 4 dates in 2 different areas of the district. So they'll be Friday, November 8th from 2 to 6 p.m., Saturday, November 9th from 8 a.m. to noon, November 15th from 2 to 4 p.m., and November 16th from 8 a.m. to noon. And the 2 locations are one north at the Silver Lake Volunteer Fire Station and south at the East Lake Fire Station, Station 32. So this is the time of year where we really encourage everyone to start collecting and disposing of those green wastes. Even though we haven't quite fully wound down fire season yet, it's time to start planning and preparing for next year. There are also some upcoming changes that were adopted by the Health District to change the burn code regulations just a couple weeks ago. So I imagine we'll be bringing that back as well and how that'll work. But in the past, we were not allowed to allow open burning during the winter months. That's now changed. So we just need to finalize the system and how we'll allow that. It'll still be somewhat limited, but upon our approval. So we'll be back with that. And then last month, you guys had a proclamation for Fire Prevention Month, which is October. So we are doing a fire station open house on October 19th at 3 of our fire stations. That'll be at the Cold Springs Fire Station, 42, Spanish Springs, 46, and Foothill Drive, Station 33. And that'll be Saturday, October 19th from 10 a.m. to noon. And we'll have staff, engines, prevention folks there to answer any questions and hand out some materials. And then lastly, as a follow-up, as requested by the board, we're setting up community meetings to discuss the proposed fire station consolidation of 30 and 32 down in Washoe Valley. As of right now, they've confirmed one date for November 4th at the Tamarack Junction at 6 p.m. Adam Mayberry is working on establishing the second meeting for them somewhere, hopefully in Washoe Valley. They're just trying to secure the site, possibly at the NDF East Lake office or over at Toyabe Golf Course. And then we'll also be presenting to the Franktown HOA here coming up in the coming weeks. So we'll be meeting with those folks and having that outreach. And other than that, you should have the dashboard on the commissioner request items and your response statistics. And unless you have any questions on those, that's all I have.
Okay. Commissioners, any questions? I have one that I'll just fire in real quick. The green waste collection days. How come we don't have one out in Spanish Springs and in Sun Valley?
I think we try and rotate it around, but it's really identifying a site, not that we couldn't, but it's staff intensive to collect it, and then we want to try and
Understood.
consolidate it as much as we can, because then there's the process of either masticating it, chipping it, burning it in the burn box, or hauling it away. So we just basically identified north and south, and that may rotate in future years. We've also had some conversations with City of Reno on trying to collaborate on that. I know Chief Cochran mentioned that they're interested in doing something in the Collin Ranch area, which would also help us in the mobile
Yes.
and the areas we have out there. So that'll be something we'll continue to look at and offering more of those sites and opportunities as we can.
Okay. Commissioners? Commissioner John. Oh, I'm sorry.
That's okay. Thank you, Mr. Chairman. Mr. Kukulis, does the City of Reno and the City of Sparks Fire do a green waste collection program?
As I just mentioned, City of Reno is interested in getting into it. I don't believe they've held any as of yet.
Okay.
But we are looking at a site out there, and I'm not familiar if Sparks has any.
So maybe could you get that information for us? Because I think we should do it all together as a region, because who cares where you live or where you drive or where you've picked up the green waste? Don't we just want it get it out of there so we're not burning down our valley? Or dumping it, which costs us a whole heck of a lot of money to clean out of our beautiful valleys and canyons. So can you please reach out to them and see what it would take? Probably not this year, right? You already have your areas, but I just feel like we used to do a Reno Clean and Green, and then we merged with also the county and the cities, because it's more important that we just get it done rather than who belongs where and who wants to drive where. This would just make it so much easier if there were multiple spots. And I mean, you know as well as I do, if it's easier to do, people will do it. If it's going to be a haul, people don't want to do it. I don't blame them. It's a whole day event. And who likes going to the dump? Nobody. It's a different price every time you go, and an argument with somebody there. So if you could reach out for that, I think that this should be regional so that it's super simple to let people get rid of the green waste, and really to educate, because as you said, they're looking at Collin Ranch. I wonder why. Because that's where all of our fires are, and that's where that line drop is. And we've had a lot of fights over that line drop with Reno Fire and who protects who. Remember, Reno put up a sign that says you're leaving the City of Reno. So I think it would make more sense to initiate that and work with that rather than competing, because the final goal is that you don't have to fight a fire, right? And to prevent that, that's really where fire science and service goes to, is which is hard to, of course, put into data, but it's how many fires have you prevented? And I would argue that the fire sciences and fire services, it's almost unheard of to hear of a house fire anymore, and that's wonderful. That's great, and that's on you and all of the professional firefighters who know that prevention is the most important thing we can do. So let's drop the boundary issues, and let's try to figure out what Reno and Sparks can do and what it would take for them to do it. Because I bet I can tell you what they're going to say. We don't have it in the budget, but maybe if they start working towards it, and we put some pressure on too. I know we're having a joint meeting next week. Put a little bit pressure on, like, how can we help you and what can we do? Because that's critical, especially, again, up at Collin Ranch, which how many fires have we had in the exact same place and how many years in a row? So let's try to be proactive in that one too, and I'm sure you are. I just want to get that on the record. Thank you.
We were happy to hear that Reno is interested, and we'll definitely continue the conversation with Sparks, and there'll be more opportunities come spring. So.
Okay, Commissioners, anyone else? I have no one else signed in. Okay. Chief, let's move to, what is it? Item B, correct? C.
That's the dashboard and the response statistics, unless there was any questions on those. You have those in your board packet.
Okay. Item 10,
All right, item number 10 is a recommendation to approve the purchase of 26 Panasonic CF33 MDTs and the including mounting and labor charges associated with that. These are effectively the computers that we have in the engines and brush trucks that connect to dispatch and give us the information related to calls and maps. We're joining under the contract, same exact computers and contract that the sheriff's office just recently used to acquire theirs. And we've been told that by IT that we have to have, the ones we currently have are obsolete come January 1, so we've got to get these installed prior to the end of the year.
Okay. Commissioners, any questions?
Mr. Chair, backing up real quick for a moment on item 9. It's styled for possible action. For the record, did you query whether there was any public comment on that one?
I did not, but we can certainly go back and open up public comment. Madam Clerk, is there any public comment on item 9?
We had no one signed in, sir.
Okay.
Thank you.
Okay, item 10. Commissioners, I will entertain a motion and then we will call public comment. I have a motion by Commissioner Burke-Bigler, second by Commissioner Herman. Madam Clerk, is there any public comment on item number 10?
I have no one signed in.
Okay, I will close public comment. Commissioners, any discussion? Seeing none, all those in favor, please signify by saying aye.
Aye.
Any opposed? I believe motion carries unanimously. Please affirm your votes. It does. Chief, item number 11.
Item number 11 is recommendation to approve a resolution to establish a post-employment health plan on behalf of the eligible employees of the district, and furthermore authorize the fire chief to execute on behalf of the eligible employees of the district a participation agreement with Nationwide Retirement Solutions, and authorizing Nationwide Retirement Solutions to act as the administrator of the plan, the agent of the district. This was negotiated in last year's collective bargaining agreement with non-supervisory employees, and then this fiscal year included in the supervisory employees. So this is now just the implementation of that post-employment health plan. It's primarily offered as a supplement to those employees that were hired after 2014 that were not eligible for retiree health insurance through the district.
Okay. Commissioners, any questions or a need for?
Move to approve, Mr. Chairman.
Okay.
Second.
I have a motion by Commissioner Jung, second by Vice Chair Lucy. Madam Clerk, is there any public comment on item number 11?
There's no one signed in.
Okay, I will close public comment. Commissioners, any other discussion? Seeing none, motion by Jung, second by Lucy. All those in favor, please signify by saying aye.
Aye.
Are there any opposed?
And can you please mark your ballots?
Please affirm your votes. Motion carries unanimously. Chief, item number 12. We're back to Commissioners and Fire Chief's announcements.
Item 12 is Commissioners' Fire Chief's announcements, requests for information, topics for future agendas, and statements relating to items not on the agenda.
Do you have any such items, Chief?
I have none.
Okay, Commissioners, anyone? Okay, I will close item number 12. Item 13, Madam Clerk, would you call public comment? Final public comment.
There is no one signed in.
Okay, is there anyone wishing to speak under public comment before we close our meeting? Seeing none, I will close public comment. Commissioners, we are adjourned.